Hi folks, Dr. Ed Beyer here. Today we're talking about the 22 different ways that thyroid function can go low, or hypothyroidism. And I know in my clinic, I've been in practice 30 years, I practice functional medicine. We look at all these 22 different ways because so many patients come to me, usually females, because hypothyroidism affects females 9 out of 10 times versus 9-to-1 ratio to females to males. And they're going to their endocrinologist or their medical doctor. They're on Synthroid, levothyroxine. The doctor's looking at TSH, T4, and it's maddening because they're still gaining weight, they're fatigued, depression, losing their hair, digestive dysfunction. They're having all these symptoms of low thyroid, and the doctor's telling them their labs are normal, or they're just keep adjusting their thyroid hormone replacement. And I see the frustration on a daily basis. It's the reason why I'm making these videos, so that people know they're empowered with this information, that there are so many ways the thyroid can go wrong that the doctor's not looking at. Reason number 13 is poor conversion of the inactive form T4 over to the active form T3 due to serotonin deficiency. Now, over 90% of what comes out of our thyroid gland is T4. It's inactive. If someone's taking Synthroid or levothyroxine, that is T4. It's not the active form T3. And the doctor is assuming that T4 is getting converted over to T3, but there are many things that will stop that conversion, and one of them is a serotonin deficiency. Serotonin, we all know, is a neurotransmitter in the brain. It's really important for brain function, but it also modulates the enzyme that helps convert T4 over to T3. So a deficiency in serotonin will cause low thyroid expression, and no one ever checks for it in the realm of traditional medicine. We do. So the causes of low serotonin, number one is taking a selective serotonin reuptake inhibitor, like antidepressive medication. This will actually cause excessive serotonin in the body, and the way neurotransmitters work and the way hormones work, when you have too much of a neurotransmitter or too much of a hormone, the body starts to ignore it. So the symptoms of high neurotransmitters like serotonin or high hormones will be identical to low. I know that's kind of a counterintuitive concept, but that's the way the body works. It's just like if I kept talking and talking and talking to someone, and no matter how interesting I may be, they're going to eventually at some time just tune me out. It's like talking to teenagers. The more you say, I have 5 children, the more you say, the less they listen. So the body's the same way. If you're on these different medications, Celexa, Lexapro, Prozac, Zoloft, and it's very common for people with low thyroid to be on these medications because low thyroid really shuts down the frontal lobes in our brain, and frontal lobes is low frontal lobe activity is what causes depression. And so this adds to the whole low thyroid picture because the body's not converting that T4 over to T3. Other reasons for low serotonin: poor blood sugar. If blood sugar is going up and down, that can cause insulin surges, which shuts down serotonin. Artificial sweeteners, aspartame, saccharin, sucralose, and all these different artificial sweeteners shut down the production of serotonin. Caffeine, alcohol, smoking, deficiencies of protein, especially the amino acid tryptophan, B6, B9, iron, and magnesium. These are needed to make serotonin. And genetic mutations, one called the MTHFR, which is an enzyme that helps convert folic acid, inactive B9, into methylfolate, which is the active B9, and we need B9 to make serotonin. I see this quite a bit. People who have this genetic mutation need to make sure they never take folic acid in a supplement form or add it into their food, and they need to be on the active form of B9 methylfolate or folinic acid. Other symptoms of serotonin deficiency: depression, because serotonin is used in the frontal lobes; anxiety, panic attacks, insomnia, irritable bowel syndrome, PMS and hormone dysfunction, fibromyalgia and chronic pain. Serotonin is the neurotransmitter that really suppresses pain perception in the brain and in the spinal cord. And migraine headaches, very common symptoms due to serotonin deficiency. But the point I want to make is that low serotonin leads to low thyroid expression. So people out there that are suffering, you need to understand that there are many, many different ways our thyroid can be depleted. This is just one of them. I'm Dr. Ed Beyer. I hope that helps. Have a great day.